Hello! It's another day where we are live, and so public health is too. Welcome to Better Together. I'm Jonathan Lyle Sexton. There are so many questions out there. Why is the food pyramid upside down now? Do I need to brush my teeth every day? Why are there so many different vaccines? Do doctors profit off of me? Am I the only one who feels the darkness closing in? There are a lot of questions when it comes to public health, but first, a question I'm sure you are asking right now. Why am I listening to this guy rattle on and on? The internet is already full of podcasts. Some of them are thoughtful. Some of them are people screaming into microphones from their cars. Some of them are three guys who definitely didn't read the article, but feel uniquely qualified to explain it anyway. What we're trying to do here is provide a space for real voices, real people, and ideally real change. A place where we talk about what's happening in our local communities with the people who are doing the work and our neighbors who are living the consequences. You know, the ones navigating the systems the rest of us don't even know exist until we hear someone complain about it breaking. We're going to talk about local issues in the Lakes region and New Hampshire. We want to talk about how the national issues will affect our state, our region, and our towns. We're going to bring in experts and people with lived experience. We're going to disagree sometimes, and we're going to use humor, because if we don't laugh at the absurdity of how some of this works and doesn't work, what are we going to do? So let's start with a pulse check. Who are we? We're the Partnership for Public Health, or PPH, which is one of the hundreds of acronyms that we're going to be throwing around in the alphabet soup that is public health. PPH exists because public health doesn't happen in one building. It's not run by one agency with one magic spreadsheet. It happens at the intersection of schools, hospitals, municipalities, nonprofits, volunteers, parents, teenagers, older adults, and that one person in town who just happens to know everyone. Our job is bringing those different people together, those different sectors, different perspectives, different priorities. We want to bring them together to the table. We work across four main pillars. First, we have our human service pillar. This is the part where we try to do our best to prevent people from falling through the cracks because someone helps them navigate the systems that were clearly designed by committee. We connect older adults, people with disabilities, caregivers, and families to housing, transportation, benefits, and the long-term supports they might need. Second, we have our emergency preparedness pillar. This is not entirely doomsday prepping. It's planning so that when something goes wrong, the response isn't chaos, followed by a press conference. We coordinate training, planning, and volunteer response across the region. This leads to our third pillar, which is our prevention strategies. This is where we work to reduce the risk before a crisis happens. It's substance misuse prevention, youth engagement, mental health support, safe storage, and of course, education. This is the kind of work that never trends on social media because when it works, nothing dramatic happens, which is terrible news for engagement, but excellent news for everyone else. Fourth, we have our community health pillar. This is the glue. Coalitions, advisory councils, data, planning. You know, the part where the public health nerds are thriving in data, but anxious from the social requirements. Making sure everyone isn't unknowingly working towards the same goal 3 different ways without ever talking to each other. This brings us to a fun little New Hampshire specific wrinkle because public health here is different. New Hampshire uses regional public health networks, which means public health is coordinated regionally instead of everything being housed at the state or county level. It's very New Hampshire. It relies on people showing up, talking to each other, and not pretending that one-size-fits-all solutions always work. Within that model, we support a public health advisory council. These are community-driven groups made up of local leaders, professionals, and residents. And does this work? Well, it does for us. So why do a podcast? Why add to the noise? Well, because misinformation is loud. So why do a podcast? Why add to the noise? Because misinformation is loud. Our social feeds are full of opinions on public health.
Think you know health? Here are 3 crazy health myths that are actually true.
The internet is full of half-truths about self-care. Here are the 5 worst ones. Charcoal toothpaste is better for whitening. I don't think so.
I care about money more than I do human life.
We're to bust the myths about over.
Public health spends a shocking amount of time discovering that reality is optional. According to national polling, about 1 in 5 Americans believe hospitals exaggerate illness for profit. That data comes from the Pew Research Center, which sounds less like a serious research institution and more like the name a 5-year-old gives when they announce out of nowhere that they're going to grow up and measure people's opinions for a living. Despite the name, the data is very real. It tracks closely with a much bigger problem, a growing distrust in institutions across the board, which means people aren't just skeptical, they're skeptical but with confidence. And that combination is doing a lot of damage. The same proportion of people, roughly about 20%, also believe germs are not the primary cause of disease, which is a bold stance given the last century of medical progress. That belief shows up in multiple surveys from Pew, suggesting that germ theory is still fighting for its life in 2026. Then there's vaccines. Despite over 200 years of testing with live subjects, the topic is still pretty contentious. 20 to 25% of US adults believe vaccines cause autism, according to Pew and the Kaiser Family Foundation. None of this reflects a lack of information. To the contrary, it reflects a surplus. We're all being confronted by a constant onslaught of information that is overwhelming, inconsistent, on trend, and often scary. We don't want to confront these thoughts in a dismissive way. These are real beliefs that real people have. These are your friends, your neighbors. They're not strangers on the internet. The noise that often stands out the most isn't the most real. It's what's the loudest. It's what's the most shocking while being presented with absolute certainty. There is a preference for simple answers, clear villains, and the comforting idea that complex systems are lying to you like your parents were when they said a cookie before dinner was illegal. Confidence is very often mistaken for accuracy. We're living in a moment where public health information gets passed around like gossip. It gets stripped of context, reposted in black and white with a caption that says, "Just asking questions," and it's occasionally weaponized by someone who read half a headline and stopped there. Half-truths travel faster than corrections. Algorithms love drama, and people are understandably skeptical because trust has been broken way more than once. Sometimes by institutions, sometimes by the people who were very confident, but also very wrong. This podcast exists to quiet things down, to talk human to human, to take public health less mysterious, less sterile, and less like theater where everyone is yelling but no one is listening. We want to learn about what organizations down the road do, how they're trying to make a difference, and what keeps them up at night. Because public health is not about telling people what to do. It's about giving them the information and systems they need to make informed choices for themselves and their community. Of course, it's about expanding the table. Too often, decisions get made in rooms that don't include the people most affected by them. This podcast is about pulling in more chairs, even if they don't fit cleanly into the narratives we tell ourselves or into the space we have here. Which brings us to the big questions facing our community right now. The ones we hope to address with this show. First, how do we rebuild trust in systems that have failed people? What does transparency actually look like beyond publishing a PDF no one reads, updates no one requested, and links no one can find? How do we show up often enough, consistently enough, and honestly enough that trust becomes earned? Second, how much duplication exists simply because organizations aren't talking to each other? How many people are going to fall through the cracks created by good intentions, siloed funding, and miscommunication? What would happen if we designed systems around people instead of paperwork that seems to require 3 signatures and a small ritual sacrifice? Third, we have politics. How do we pull partisan noise out of public health conversations without pretending values don't exist? How do we protect evidence-based work from becoming a political football that gets kicked around every election cycle? How do we advocate for our communities without turning every issue into a culture war where no one actually wins? Fourth, and maybe the most uncomfortable, what do we do when incorrect information comes from someone people already believe? How do we correct without being condescending or dismissive? How do we respond when silence feels easier but truth matters more? See, these aren't abstract questions. They show up in school board meetings, town halls, family conversations, budget discussions, and even dinner tables when everyone else is silent and someone decides to bring up what they saw doom scrolling on Facebook. That's why we're starting this. Not to have the final word, not to pretend we have all the answers, not to add to the noise that you might see doom scrolling on Facebook, but to ask people better questions. We want to ask the people that are willing to sit down in the complexity instead of shouting over it. We are better when we answer questions together, which brings me to our guest. Someone who sees issues up close, someone who understands both the systems and the people inside of them, not just in New Hampshire, but also in other states, giving her the context for exactly how weird our system is. She is someone who has opinions, evidence, and probably a few stories that don't fit neatly into a grant report. Today, I'm joined by Tammy Carmichael, the CEO of Partnership for Public Health. I've worked with Tammy for over a year now, and one thing becomes clear very quickly. She understands public health at both the systems level and the human level. She knows how the machinery works, but she never forgets who gets caught in the gears when it doesn't. Tammy brings decades of experience in public health and human services, from state-level work to nonprofit leadership. Since stepping into the CEO role here at PPH, she has helped guide real growth, strengthening our team, expanding programs, securing funding, and keeping our focus squarely on community impact, not just processes. She's also, and this matters, the undisputed queen of metaphors and puns, which turns out to be a public health superpower. If you can explain a complex system with a metaphor people actually will remember, you're already halfway to making it work. What I respect most is that Tammy is honest about what works, what doesn't, and where we still need to do better. She asks hard questions, listens carefully, and isn't interested in public health that looks good on paper but fails people in real life, which makes her the perfect person to start this conversation. Thanks for being here, Tammy.
Thanks for having me. I appreciate it. Thanks for having me as the first person.
Yeah, we're super excited about this. You've been a part of this process for a very long time of the whole public health system. You worked in Florida for a long time running programs there in the public health department. When throughout all of your work, when people have talked about who decides what work happens with public health, what answer do you typically give them?
I mean, there is a steering committee that tries to understand the community at large, and that comes from a community health needs assessment, which we're actually in the middle of right now, in partnership with Concord Hospital. And that community health needs assessment goes out to community health leaders. It goes out, we do focus groups with certain audiences that we feel we need to really understand in our community. And we also do just surveys to the general community at large. And we look at the data from other resources around our community, and we aggregate that data, as well as look at the answers to questions that are developed. And then the people come together from the steering committee, and we basically look at it and try to make decisions. For me, I'm the queen of analogies, right? And I grew up on a dairy farm, and when you milk a cow, the milk separates from the cream and the cream rises to the top. So basically what we're looking for are the concerns and issues in the community that rise to the top. So I feel like the whole community has a chance to be a part of those decisions that are made, as long as they respond to the surveys and talk to the healthcare leaders in their community. They can have input in what that cream is that rises to the top that we really need to focus on in our community to make it healthier and safer to live in this community.
So when you're talking about the cream that rises to the top, is there anything that you feel like is just continuously missed because other things keep getting bumped above it, if that makes sense?
I often feel like not maybe missed, but what happens is when we start doing really well at something and it no longer is a big issue, then we turn and we work on the next issue. And we forget to maybe sometimes do the foundational, at least some work to keep that at not becoming a problem again or not rising up again. So we need to put some stabilization systems in place that make the problem hopefully stabilize long term. And I feel like sometimes that gets missed in the process because we move on to the next issue or concern at hand, and we forget that we need to keep some systems in place to stabilize the issue we just took care of. So
yeah, you want to make sure that there is a continuity plan. always set up so that way things can.
Yes, continuum of care. It's like when you're taking care of your yard, even though it's mowed today, you have to continue to take care of that yard or it's going to get out of control again down the road. And so even though we've taken care of a problem and we feel like we've got it stabilized, we do have to continue to do things to make sure that that remains stabilized in our community and remains like healthy and safe for our community.
Yeah. And one of the things that goes hand in hand with making sure that the programs are stabilized and lasting is funding, obviously. And right now we are it has been a interesting year, to say the least, for nonprofits, for public health funding in general. There's been a lot of shifting and shaking, and I know it, obviously here at PPH, we've had a few things shake. We haven't been as affected as other organizations, but how do you keep everybody feeling grounded through all of this change, all of the shakeups, everything that's happening?
I feel I have somewhat of a different take on this as well. I often say we're a business similar to any business. Yes, our tax status is nonprofit, but just in regards to for-profit businesses, they have just as much instability in their profits as we have in our funding sources as well. For example, a business has to look at the economic situation. Inflation affects them and their profit status. During COVID, a lot of layoffs happened to for-profit businesses because our economy changed. People weren't maybe eating out as much, maybe utilizing some of the goods and services that they normally use. So a lot of layoffs happened in for-profit businesses at that time. A lot of times for-profit businesses don't know when a change in the economy is coming. It's more of a surprise to them, and they have to pivot and adjust, and they have to make sure they have a good diversification of funds and they have operational reserves. And so for a nonprofit business, from my perspective and a lot of the colleagues that I work with, we also need to make sure we have diversification of our funding sources. We have to have our operational reserves in place. We are a business. Our funding, in some ways, is a little bit more stable because when we do get a grant, a lot of times it's for 2 or 3 years. So we know we have that stabilized funding for 2 or 3 years and that we can do that programming for that amount of time. Yes, this year that has kind of come in flux. Some of that 2 or 3 year funding got pulled back, but because our organization had a diversification of funding, we didn't just have one funding source for our prevention work that we do, but we had a federal funding source, a state funding source, and some local funding sources that when that federal funding source did get pulled, we could continue at a reduced scale, but we could still continue the work that we're doing in the community. We could prioritize what we felt the biggest impacts were and continue that work on in the community while that federal funding was in flux. So having that diversification in funding, having a little bit of operational reserves in that funding stream as well, helped us navigate that storm that we were in at the time.
Yeah. I think that was I don't even know the right word for it, but it's been the big conversation amongst all nonprofits. And I think it's been one of the big things that everybody has been struggling with, figuring out what to do, how to do it. And I think you're exactly right. There's for-profit entities always struggle with this. And this is kind of the first time it's being brought to the nonprofit side. Not really the first time, but it's the most major time.
It's I feel in my 30 years of working in nonprofits, off and on over that 30 years, this is the time that I feel the most destabilization of funding, and also just maybe a lack of understanding of the fact that we operate as businesses and we do social profit, not monetary profit. And so the profit is a little bit different from what normal society, not normal, but
Yeah.
everyday society understands.
Yeah.
Because monetary profit is what our society is mostly foundation.
Yeah. It's just what we're going after.
Yeah.
Yeah. I like the idea of social profit. Social profit is huge, especially in the nonprofit sector. I always, my background is in nonprofits, and in that, when I was reading books and stuff for college, it was always, it's not, it may be called a nonprofit, but that doesn't mean no profit, right? Whether that is a little bit of monetary that you just figure out how to reuse, but also then there is the social profit. There's always the benefit that you're giving to people and you're helping with. And I think hand in that, we could talk forever about the nonprofit side of things, but also with public health right now, there is a lot of news, I would say, coming from just changes happening in thinking, different groups, different committees, stuff like that, that are happening at the federal level. Do you feel that any of that change has impacted your day-to-day? And how do you, how in general, because I know there's obviously federal grants that we have, so there's very tightrope-ish language that needs to be used, but do you feel like a lot of those changes have come down to our day-to-day, whether it is the food pyramid, vaccine recommendations, just other huge national topics that get a lot of the attention in the spotlight in terms of column inches for a newspaper, but how much is that really affecting the Lakes region? How much of that is really affecting our day-to-day here at PPH?
I definitely believe that it's affected individuals more than we probably really understand right now, from services changing, causing anxiety to individuals who depend on community services that are available. And I believe everyone at some time in their life has needed help and assistance from a community service, or has had a family member that needed help or assistance from a community service. And so when those community services become unstable, they just cause a ripple effect in the fabric of our society and the individuals. And so I believe that we'll find in years to come that there was more of an impact than we really understand right now. As far as organizations, definitely it impacts. Just like I said, when the federal funding ended for one of our prevention programs, the complex work that we did got boiled down to just a handful of priorities that we're keeping afloat during this time. And so the impact definitely becomes less to the youth, because this was a youth-focused program. It definitely becomes less for those youth that we're seeing that the effects of that program and the parts of that program happening in their weekly and daily lives in our community. So definitely there's an impact. The data will show. It always takes longer for that to show in the years to come. But, again, trying to just keep a handful of the pieces of that programming happening so that the youth, that safety net is there, and we don't see the huge impact that we could have seen if we take away all the programming from that program. So certainly it's hard for us because we are invested in the work we do. We are invested in our youth and helping them make good choices in their lives and choosing a healthy path for their future so that our community grows, and as they become adults, they grow into healthy adults with healthy choices. That just makes our community a better place to live.
Yeah. Recently, with all of the changes and the messaging that's kind of coming out, how do you feel like that has affected how the local community, right, that New Hampshire is so wanting to focus on, right? How do you feel like the messaging that's happening externally is affecting their trust in public health organizations and nonprofits in general? How do you feel like it's affecting? Do you feel like there's more? Do you feel like there's more mistrust happening? Do you feel like they're starting to lean into organizations more because that's where they know, like, oh, you are a local organization. I've known you've been around for 20 years, right? I want to connect more with you. Or do you feel like they're leaning away from it towards, oh, nonprofits, public health right now, I don't know how to feel about that, right?
I see it as more of a fatigue. I see it as people don't even want to talk or hear about it anymore. And so we've kind of, have this place and time where it's hard to get people to even listen or have a discussion because it's fatigue with the fact that the pandemic was so unprecedented and people were tired of hearing all the messaging that needed to happen and the education that needed to happen. Even, our main one is vaccination rates have really declined. Even for some of the vaccinations that people used to get routinely, the flu vaccine, because, they were really trying to keep, those people that are compromised with their immune systems near them from getting the flu. Now they just don't want to get the flu vaccine because it's a fatigue of hearing about vaccines over and over. The distrust that has brought and not wanting to spend the time to really dig into it or having the time to dig into it and decide what is the right thing to do. Instead, there's too many other issues with our economy and housing concerns that we have for them to even focus on it. They're just fatigued and at this point, maybe a little apathetic about even wanting to listen at this point in time.
Yeah. Oh my gosh. And that's why we want to have these conversations, is because we understand there is fatigue and everybody's just tired of everybody saying, oh, look at me, trust me, I'm who to go to. And I think having a space where we can bring everybody to the table and have the conversations that people might not be able to have, right? When they're just looking at their social media feed, when they're looking at the news, when they're in all these different facets of their life where there is information coming at them, they don't have the time to go and ask the questions. They don't often have the chance. They don't know who to talk to about these things. So having a space where we can bring people in, have those conversations, I think that's what we're trying to do here. So thank you for being our first guest, and thank you for coming in. And yeah, we really appreciate it.
Thank you for having me. I can talk public health all day, every day.
Awesome. And that's our show. Thanks for listening and for sticking with us through the questions, the nuance, and the occasional attempt at humor. We're launching with 3 episodes today, and we'll be back every 2 weeks with new conversations just like this one. If today's episode sparked a thought, a question, or a polite disagreement you're still working through, that's the point. Subscribe to follow us so you can stay in the conversation and never miss an episode. Feel free to connect with us on our socials at PPHNH or online at pphnh.org. Better Together is a Partnership for Public Health production. It's produced by me, Jonathan Lyle Sexton, and Emma Peterson, with technical direction from Tessa Donahue. The show is written and edited by me, Emma, and Tessa, which explains both the structure and the amazing sense of humor. We want to give a sincere thank you to Tammy for joining us today and helping us start this conversation the right way. We'll see you next time.